Dr. Means.
Thank you. Good morning, Chairman Cassidy, Ranking Member Sanders, and members of the Senate Health Committee. I want to thank President Trump for nominating me to serve as Surgeon General and for Secretary Kennedy for his support. Thank you for also being willing to postpone this hearing. When I went into labor 5 hours before the hearing started in October, our precious baby boy was born on the hearing day. As a physician, I have always been inspired that the root of the word healing means to return to wholeness. Nothing is more urgent than restoring wholeness for Americans, physically, mentally, and societally. We are now the most chronically ill, high-income nation in the world. We live shorter, sicker lives than peer high-income nations. Today's children are projected to live shorter, sicker lives than their parents. We spend trillions annually on reactive sick care. Nearly 150 million Americans are on federal health care programs, and we spend $50 billion per year on research. Yet outcomes are worsening and disparities are widening. Our nation is angry, exhausted, and hurting from preventable diseases. Rates of high blood pressure, many cancers, autoimmune conditions, type 2 diabetes, mental health disorders, dementia, neurodevelopmental challenges, and youth suicide have all increased in the past 2 decades. This public health crisis is touching every American family. It is robbing our children of possibility, our workforce of productivity, and our nation of security. It strains our federal budget and dims hope for millions. We must confront this epidemic through a vision grounded in science, dignity, shared humanity, and a respect for freedom, not politicization and division. Public health leaders must address the evidence-based, modifiable drivers of chronic diseases, which include ultra-processed foods, industrial chemical exposure, lack of physical activity, chronic stress and loneliness, and over-medicalization. I've been asked to help our nation get healthy and answer the call of millions, especially mothers, who are begging for transparency and support. That is what I'm here to do. I believe that every American shares a core yearning to thrive and help their families thrive. But we are asking people to make healthy choices in environments that are squarely structured against them. Good policy and education can make health easier, more affordable, and more accessible. I know our current leaders at HHS and across the federal government are committed to the ambitious policies outlined in the MAHA strategy released last year that focuses on advancing research, aligning incentives, increasing public awareness, and fostering private sector collaboration to end the chronic disease epidemic. Specific efforts are already underway to fund and promote more whole, healthy food for Americans, address financial conflicts of interest in our agencies, fund research focused on disease prevention and reversal, and make institutions accountable to measurable health outcomes for all Americans. President Trump and Secretary Kennedy have invited a mature, candid, grand conversation about how our medical education and fixing perverse incentives can pull us back from the brink, and for this I am profoundly grateful. My professional history has prepared me to meet these very complex times as an innovative, unifying, and practical leader focused on reversing chronic disease. Over the past 15 years, I have treated thousands of patients in clinics and operating rooms. I have run my own medical practice and co-founded a health technology company that empowers individuals with metabolic health data to address blood sugar dysregulation, a problem now affecting over 50% of American adults and 30% of teens. In this role, I recruited leading researchers from Yale, UCSF, Brigham Young University, Cleveland Clinic, and more to support this effort. And the company launched a 10,000 participant academic industry research collaboration on early metabolic disease detection. I've held biomedical research positions at the National Institutes of Health, Stanford University, New York University, Oregon Health and Science University, and published this biomedical research in leading medical journals. I was recruited as a faculty course director at Stanford University, where I taught undergraduate and graduate students on nutrition and health. I have served as an associate editor of an international medical journal focused on prevention and disease reversal. I have spoken internationally on chronic disease and wrote one of the most successful health books of the decade, outlining a vision for reversing this epidemic through personal empowerment, culture change, and policy reform. I graduated from Stanford University with honors and from Stanford Medical School, where I was inducted by unanimous faculty vote into the Honor Society for Patient Care. In conclusion, mental and physical health are unraveling from shared root causes that we can fix. Preventable heart disease, our #1 killer in men and women, is emblematic of a nation with a broken heart. Diabetes, representing cellular energy collapse, is draining our human potential. Dementia, depression, and neurodevelopmental decline reflects a society losing its mind. Our bodies are telling us this current path is totally unsustainable. There is another way, a path that unites rigorous science with reverence for our miraculous bodies and planet and brings Americans and our medical institutions together around actual healing and prevention. This path is also economically sound, with the potential to save trillions of dollars annually. As I sit here in the early months of motherhood, I feel profound awe at the privilege we have as adults to create a better world for future generations. And that is why I'm here. As Surgeon General, I would call on every American and the Public Health Service to join in a great national healing, one that halts preventable chronic disease, makes healthy living the easiest choice, honors the body's connection to the environment, and puts America back on the road towards wholeness and health. I look forward to answering your questions. Thank you.
If confirmed, you'll be the nation's doctor. And to better understand your best medical opinion on various topics, I'll ask you some things that have been of concern to this committee. I have 7 things to ask in 5 minutes, so please be tight. There won't be trick questions. Do you believe that the abortion pill, mifepristone, is safe and should be prescribed without an in-person visit with a physician?
Thank you so much, Senator Cassidy, for your question, and also thank you so much for meeting with me virtually before the hearing, and also to your staff for meeting. I think that every medication has risks and benefits. I think that all patients need to have a thorough conversation with their doctor and have true informed consent before taking any medication.
Should there be an in-person visit required?
This is the question of whether there should be an in-person visit is out of the purview of the Surgeon General's office, but I do believe that every patient needs to have a very thorough conversation with their doctor before taking any medication. Unfortunately, in our current healthcare system, because of how overburdened doctors are, this often doesn't happen, whether it's in person or online.
Do you believe that birth control is safe, should be widely accessible, including perhaps without a prescription?
I absolutely think that oral contraception should be widely accessible. Just as I said with mifepristone, I believe that especially when it comes to oral contraceptives, we need to have patients having a conversation with their doctor about risks and benefits. Like all medications, oral contraceptions do have significant risk, and we need to make sure that women are empowered with information and informed consent before getting on a medication that's often prescribed for several years without follow-up.
Tragically, next question, we've had 2 children die from measles in West Texas. We now have an outbreak of like 1,000 children almost in South Carolina area. You're a mom. We're on the verge of losing our measles elimination status. Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine? Like you,
I'm a physician. I believe vaccines save lives. I believe that vaccines are a key part of any infectious disease public health strategy. And I would work with you, the CDC, the NIH, ACIP,
but would you
FDA.
encourage mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die and this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent, needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body. I absolutely am supportive of the measles vaccine, and I do believe vaccines save lives and are an important part of the public health strategy.
We've had a tough flu season this year. Would you, as past Surgeon Generals have, encourage Americans to get vaccinated with the flu vaccine?
At the risk of sounding repetitive, I do think it's very important as a physician and to rebuild trust in public health to make sure that patients are encouraged to have informed consent with their doctor before getting any medication. I believe vaccines save lives. I believe they're an important part of public health. I also do not want to not encourage patients to have a conversation with their doctor. I think it's incredibly important, and informed consent is going to be part of building trust in public health.
We've had an outbreak of whooping cough in Louisiana, vaccine-preventable disease. Children have actually died from it. Think about it, a child about the age of your child dying from a vaccine-preventable disease. And some have been scared to vaccinate their children because they've been told incorrectly that vaccines cause autism. Do you believe that vaccines, whether individually or collectively, contribute to autism?
Senator Cassidy, you're a physician. I'm a physician. The reality is that we have an autism crisis that's increasing, and this is devastating to many families, and we do not know, as a medical community, what causes autism. The administration has just committed a huge amount of funding to look at the exposome of all environmental factors that could be contributing to autism, and until we have a clear understanding of why kids are developing this at higher rates, I think we should not leave any stones unturned.
There's been a lot of evidence showing that they're not implicated. Do you not accept that evidence?
I do accept that evidence. I also think that science is never settled, and I think that the effort to look at comprehensive cumulative exposures of our exposome into what is causing autism is important, and I look forward to seeing those results and sharing the best public health information with the American people.
Well, I got through 5 out of my 7, so thank you for cooperating.
And like the chairman, I've got a lot of questions in a short period of time. I enjoyed your opening remarks, and I think you're right. This is a country that is sick in many ways. We need to focus on disease prevention rather than spending a huge amount of money on tertiary care. And I've enjoyed and appreciated some of the remarks that you have made in the past. So let me just see if we're on the same page here. When I was sitting where Senator Cassidy is now, I fought hard to have much more substantive labeling on junk food. In fact, it's my view that we should not have food manufacturers selling junk TV ads. My understanding is you have come out against junk food ads on television. Is that correct?
Yes.
Can you just take 30 seconds to elaborate that? Would you use your position to ban junk food TV ads?
Thank you so much, Senator Sanders, and I agree with you completely. I think there is so much that we agree on these issues. Just to be clear, the Surgeon General's office does not have the purview to ban this.
But you have a voice.
Absolutely, and that's a voice I would absolutely lend to talking about the dangers of ultra-processed foods and getting these advertisements off TV. Right. This has long been a part of my message. I talk about it in my book.
Senator Marshall mentioned earlier ago the crisis we have in obesity, childhood obesity. And you have these manufacturers selling sugar-laden products that cause obesity.
Yes.
So you will speak out. And do I understand your view is you would fight to ban TV ads of junk food?
I think you will be frustrated by how much I will be talking about ultra-processed foods.
Good. I won't be frustrated. I'd be delighted. All right, let me ask you another area that we may have some agreement. As you know, the United States and New Zealand are the only 2 countries in the world that allow the pharmaceutical industry to advertise on TV. I believe we should ban those ads. How do you feel?
I agree with you.
Okay.
I mean, just to elaborate, as you know, but for anyone who might be listening, about 65 to 70% of the calories that our children are eating are ultra-processed frankenfoods made in factories that are so disconnected from their origin, source, and nutritional value that, we're putting just nutritionally devoid food in our children. And then we wonder why we have an obesity crisis in children and why chronic diseases are rising as early as
No, you're right.
toddler years. So
No, that's right.
my vision in this role is to get more whole, healthy foods on American plates.
And we spend a fortune.
Fortune.
We make people sick, and then we spend a fortune trying to keep them alive. All right, those are important areas of agreement, and I appreciate that. But I want to pick up on an issue that the chairman raised, and it's a terribly important one, and that deals with vaccines. And I think the answers you gave us were a little bit political and not to the point. The American Medical Association, I don't know if you're a member of it or not, is the largest professional association of physicians representing over 270,000 doctors. And they wrote in November that, quote, an abundance of evidence from decades of scientific studies shows no link between vaccines and autism, end quote. In contrast, Secretary Kennedy has said, quote, I do believe that autism does come from vaccines, end of quote. Dr. Means, who is right? Is the AMA right? Is the scientific community right? Or is Secretary Kennedy right?
As I said to Senator Cassidy, we have a situation where autism is rising.
It is.
This is a huge problem.
It is, but we don't want conspiracy theories to
Absolutely. I 100% agree with you. And also, as a biomedical researcher and physician, I am not going to sit here and say that we should not study something in the future. It's not a political answer.
We should study everything.
We should study the different factors that may be causing.
I agree. But you have scientific evidence. The overwhelming body of scientific evidence says vaccines do not cause autism.
I'm not, so just to be very clear, vaccine advocacy has never, or any anti-vaccine rhetoric has never been a part of my message. I don't mention the word vaccine in my book. This is not a part of my core message. I am not here to complicate the issue on vaccines. And also, I, as a physician, am very careful with my words, and I don't think it's responsible to say that we're not going to study when kids are getting many medications. I think it's important to just keep it on the table.
Last question. I'm sorry, running out of time. We are the only major country on earth that does not guarantee health care to all people as a human right. Dr. Means, is health care a human right? Should the United States join every other major country and say to everybody, whether you're young, old, rich, or poor, you are entitled to health care as a human right? Yes, no, maybe?
My focus is on ensuring that Americans have access to the best health care in the entire world, which, as you talked about, as I talked about, as everyone who's spoken is talking about, is pretty much the opposite of what we have right now. We spend 2x every other country in the world, and we have the worst health.
I agree, but is health care a human right? Will you join me in fighting for a national health care program?
I will be by your side trying to get Americans access to the best health care in the world.
Thank you very much.
Senator Murray.
Thank you, Mr. Chairman. Thank you, Dr. Means, for being here. Let me start with this. You called birth control pills, and I'm going to quote, a disrespect of life, and you said Americans, quote, use birth control pills like candy. You also claimed, contrary to established science, that hormonal birth control has, quote, horrifying health risks for women. Now, here are the facts. There are 18 FDA-approved contraceptive methods, both hormonal and non-hormonal, and there are decades of evidence showing that every one of these birth control methods is safe and effective. So I wanted to ask you, help me understand, should women trust the FDA, which approved all 18 methods of birth control after a very rigorous look at the evidence, or should they trust your statement that there are horrifying health risks to birth control, which contradicts that evidence?
Thank you, Senator Murray, for your question. I'm curious if you're aware of what the side effects of hormonal contraception are.
I'm curious if you are with the FDA that went through all of these and rigorously looked at them, or as Surgeon General, if you're going to tell the truth to the American people.
I absolutely believe these medications should be accessible to all women. And also, all medications have risks and benefits, and in our current medical climate, with the burden on doctors, doctors do not have enough time for thorough informed consent conversations. Some of the horrifying side effects of birth control that I have mentioned include blood clots and stroke risk in women who have clotting disorders, who are smokers, who have obesity. No, it's not general. I'm very careful with my words, and when I say those comments, which are taken out of context, I'm speaking about particular women that can be hurt if there is not informed consent about their medical history, their lifestyle exposures, and their family history. I want those women, and I know you do too, to be able to have a thorough conversation with their doctor and know whether they are at higher risk for side effects when prescribed the medication.
Saying that is one thing, but saying on, different shows that birth control pills are a disrespect of life is very different.
I am passionate about women's health, and I think it is disrespectful
people use
to women.
Birth controls like candy is very different than what you just said.
We prescribe a huge amount of hormonal contraceptive, and I do not believe most of those conversations have informed consent because of the pressures that doctors are under because of our broken healthcare system. I want what's best for women, as do you, and I want every woman who could be at risk for a side effect.
2 minutes left, and I have other questions. Let me move on. Thank you.
If a woman died from a stroke or a blood clot because they did not have a thorough conversation.
Thank you for your answer. You made that clear. Let me go to another question. Tracy Beth Hogue, she's an anti-vaccine skeptic. She was elevated by the Trump administration to serve as the top drug regulator at FDA. She made comments last week casting doubt on the safety of RSV vaccines for baby. As you sure know, RSV can be deadly even for healthy full-term infants. Do you believe that Dr. Hogue is wrong to question the safety of RSV vaccines?
I have not read that article or seen that quote. I would need to know what she said before I commented on that.
Well, you do know that RSV is the leading cause of hospitalization for infants.
I have a 17-week-old, and I'm very aware of that.
You hear her statement. As Surgeon General, would you contradict it?
I certainly have absolutely no issue having very frank conversations with anyone in the administration if I believe that their statements are misguided in some way or not fully informed. That's not a conversation I would have publicly first. I would have a private and direct conversation with anyone in the administration if I felt that patients were at risk because of.
All right, and I also want to ask you about maternal health. Mental health conditions are the leading cause of maternal death in the U.S., including suicide and overdose deaths. In her comments last week, Dr. Hogue, same woman, also expressed concern about the safety of the antidepressants during pregnancy. Specifically, she called out SSRIs, the most commonly prescribed type. Do you believe that SSRIs are dangerous for pregnant women?
I don't want to be a broken record here, but I do believe that every medication has risks and benefits, and you need to have a nuanced conversation with your doctor before starting a medication. That is, I think, the most responsible position for any doctor to share.
Well, strong evidence has shown that SSRIs are safe in pregnancy. Most do not increase the risk of birth defects.
Certainly.
But untreated depression in pregnancy puts women at risk.
And I agree with you, but I still think a patient, I don't think it's responsible to make a blatant statement for all Americans.
Okay, well, if confirmed as Surgeon General, it will be your job to give accurate and up-to-date health information to the American people. I assume you will take that responsibility seriously.
I absolutely do, and I also believe that the American people are looking for a more nuanced conversation about health, and I believe that will help restore trust in public health.
Thank you.
Senator Baldwin.
Thank you, Mr. Chairman, and thank you, Dr. Means, for being here today. You spoke in your opening statement about building trust in public health. And you also made, I think, a passing reference to conflicts of interest within agencies in HHS. So I want to ask you a few questions on that point. Dr. Means, you've promoted a lab testing company, Genova Diagnostics, which is backed by private equity and may charge customers several $100s for its services. Before you began promoting their tests on social media, the company agreed to pay $43 million to resolve allegations that it had billed for medically unnecessary lab tests and violated the False Claims Act. You personally accepted $10,000 from this company. And I want to ask you whether you were aware of Genova Diagnostics' prior violations and the settlement when you started promoting their services.
Thank you, Senator Baldwin, and also thank you so much for meeting with me beforehand. I really enjoyed our conversation. Frankly, I was not familiar with that settlement.
So that's
There's a particular test that they make about nutrient quality that I find very compelling, because I do think we need to understand a little bit more transparently about how the nutrients from our food are affecting our health. And I would just highlight that I have worked extremely closely with the Office of Government Ethics over the last several months and taken this process very seriously. I've signed a letter that outlines how to rectify any potential conflicts. And I
know you're going to divest your
absolutely
stocks in all sorts of health-related and non-health-related entities, but it's troubling because the Surgeon General must be someone that the public can trust, and someone who does their homework before accepting money or lending credibility to a company. And for me, this raises questions about your judgment. It does not inspire confidence that you're here to make Americans healthy when you accept money to promote a company who's had to pay a settlement because of violating the False Claims Act. Dr. Means, you have also promoted a range of supplements, including those that claim to promote longevity and detoxification. You made at least $325,000 from promoting supplements since the beginning of 2024, according to information provided to this committee. This includes nearly $135,000 for a so-called longevity supplement and $46,000 for wellness teas and elixirs, both of which can cost upwards of $100 a month for somebody consuming them. Your company, Levels Health, offers continuous glucose monitoring and AI-driven health insights. And a full membership, and I'm not sure what all a full membership involves, but costs $1,500 a year. And that's about a whole month's average rent for a one-bedroom apartment in Milwaukee, Wisconsin. So do you really believe that most Americans can afford to spend upwards of $1,500 a year on your supplements and programs? And is that one of your solutions to our nation's health problems?
Thank you for the question. I certainly don't think every American needs to be wearing a glucose monitor. I think that we have a monumental blood sugar problem in this country that underlies most of the leading causes of death in this country: dementia, cancer, diabetes, heart disease, stroke are all connected by metabolic dysfunction, elevated blood sugar. And my work on using entrepreneurship as a tool to bring and study new tools that can help us understand our blood sugar better, I believe I'm very proud of. And as I mentioned in my opening statement,
thank you for that statement and those observations, Dr. Means.
And that research that we've done with the company is meant to benefit all Americans. It does not necessarily mean that
tie up in my remaining 12 seconds. Dr. Means, you say you want to address chronic disease, but 1/3 of low-income adults have 2 or more chronic conditions. They need an affordable solution. Groceries are too expensive. Health care is too expensive. Health insurance premiums have skyrocketed because of Republicans' refusal to extend the tax credit and cuts to Medicaid. 15 million Americans are losing their health insurance. People cannot afford their prescription drugs. So you've said that our healthcare system is broken, but it seems to me that you've spent your career sort of making money off the flaws in the system, and I'm left wondering how the American people are supposed to trust you to put their health and safety first, not profits.
Those are incorrect characterizations. I appreciate your comments, and I do look forward to working with you and on your priorities, and I absolutely am committed to giving Americans the best public health information possible. And like the comments I made prior, I think some of the movement in our administration towards making healthy food more accessible are going to impact all Americans in a very positive way, and I look forward to helping on that and many other issues that make healthcare accessibility much easier for all Americans.
Senator Husted.
Thank you, Mr. Chairman. Dr. Means, thanks for being here today. I'm going to try to get through pesticides and mental health for our children, if I could. I want to thank you for what you're trying to do to raise awareness about healthy eating, healthy foods. And since your nomination, and though I've had a lot of questions from farmers in the agriculture community in Ohio about your comments on pesticides. And you will not regulate pesticides in your role, but your views will impact American consumers and what they believe about what's healthy and good for them. What is a pesticide? Now, I would just put a little poster up here, and why do we use them? Because this is the kind of thing we try to prevent. This is an earworm. This is the kind of thing that destroys our crops in all across the country. Corn, wheat, soybeans, fruit, and vegetables. If we fail to use proper pesticides, it will drive down yields of 20 to 50%, even more for fruits and vegetables, the very things we want people to eat more of, which will restrict the supply chain, make food less accessible and more expensive if we can't have proper crop yields and use more land, more resources, et cetera. And so given all those facts and given what the concerns are, please just share your views on pesticides for what they mean to the average consumer of food in our grocery stores.
Thank you, Senator Husted. And thank you so much for meeting with me prior to this hearing. This is a very complex issue. And what I would just want to start by saying is that I have the utmost respect for the American farmer. And I think just like doctors, farmers are in an impossible situation right now, where we have developed an agriculture system that is dependent on chemicals that are toxic to have an affordable food supply. And that's not good for farmers. It's not good for consumers. It's a complex issue. And obviously, changing anything overnight would be devastating to the American farmer and the American consumer. With that said, this administration is committed to understanding what's in our food and how it's affecting our bodies and how cumulative exposures to various chemicals in our environment is affecting us. And that is a core, profound, long-term, deep passion of mine as someone who thinks about how our environments and the system that we live in is affecting our health in the midst of this monumental chronic disease epidemic. And certainly pesticides, herbicides, insecticides is something we need to look into as part of that cumulative exposure. So it's a complex issue. It's very sensitive for farmers and for American consumers, especially mothers, because we want to have the safest water and the safest, food supply in terms of what's on it. But I understand the nuance of these issues and that changes need to be made thoughtfully with full respect for American farmers and the constraints that they're under. And also, eventually we are going to need to move towards a more sustainable way of growing our food that decreases our reliance on toxic chemicals that are hurting human health. I think there are incredible movements happening within the administration. Like I mentioned, the $700 million going towards regenerative agriculture transitions, precision agriculture, and the private sector collaboration that may be using technology to help be more precise with pesticide spraying. And I think those are all positive developments. But at the end of the day, we do need to understand how these chemicals are affecting our bodies and work towards creating the safest
Great.
food system.
I have one more, three quick questions for you. It's on mental health of our children. And I'm going to ask all three of them to give you a chance to respond. Do you believe that smartphones and social media are negatively impacting the health of America's children? What age should a child have access to a smartphone and social media, and what would you recommend? Would you recommend banning smartphones in America's schools?
I believe that the research is showing that the impact of social media on children is profound and negative, and we need to take great efforts to protect children from premature use of technology that is associated with mental health issues and depression, and it's a strong concern of mine.
And at what age does the research say that we should have, give child access to a smartphone?
I don't have the answer to that question. I don't know if an exact number is known, but I think in light of how quickly things are moving with technology and social media and how rapidly things are changing, we need to as parents, communities, schools, and a government exert an abundance of caution and be very proactive about making sure we're protecting children and their mental health.
I hope you'll spend some time talking about this issue in your role as Surgeon General, because if you go to a school that's banned smartphones, they will tell you it has a profound
Absolutely.
difference on the mental health and the educational environment in those schools. So thank you. For being here.
Thank you, Mr. Chairman. Good morning, Dr. Means. Dr. Means, are you familiar with FTC policy that requires those who are recommending products online to disclose their financial connection to those companies? In particular, the document from the FTC says this: if you endorse a product through social media, your endorsement message should make it obvious when you have a relationship with the brand. Are you familiar with that?
Certainly.
That guidance? As you know, there is a pending complaint regarding your failure to adhere to those guidelines that basically makes the contention, and this committee has verified the data that underlies their complaint, that you routinely violated this policy, and that, in fact, in the majority of your posts for many of the products you recommend, you did not transparently reveal your financial connection. Let me give you an example.
That's false.
Well, I'll give you an example. So there's a prenatal vitamin called WeNatal. Your filings before this committee show that you started receiving compensation in the spring of 2024. And yet in September of 2024, you posted a video saying that you had no financial relationship to the company, just a big fan. And then in October, you said, not sponsored, just love these. But in fact, you have documentation before this committee that showed when you said those things, you had a financial relationship. You had already started receiving money from that company. So you weren't telling the truth when you said you were just a fan. You were actually receiving money, correct?
If in any post where I said I am not receiving money, I had not been receiving money at that time.
But you had received partnership fees for this particular prenatal vitamin. In fact, prior to September and October, you had posted partnership links in which you get compensated based upon click-throughs, correct?
I'm happy to look at whatever documentation you're talking about, but I do not. It's incorrect and it's a false representation. And just to be very clear, I've spent the last several months working with the Office of Government Ethics to be fully compliant with this process. I take it very seriously. Before, during, and after, if I am in office, I will be in full compliance with the Office of Government Ethics. I think, as I've talked about, conflicts of interest are incredibly important to rectify if we're in public service, and I am fully committed to continuing to work with them.
So let me give you some other examples. Function Health, which is your lab testing platform, data shows that you disclosed your partnership with them less than a third of the time that you recommended their services online. Genova Diagnostics, you disclosed your sponsorship in only 2 of the 9 times that you promoted Genova. Daily Harvest, you disclosed your sponsorship in only 3 of the 14 posts recommending that product. Zen Basil Seeds, you disclosed your partnership only 2 out of the 13 times that you recommended the product. This seems systemic. It seems that in the majority of instances in which you were, as a medical professional, recommending a product, you were hiding the fact that you had a financial partnership. You seem to be in regular willful violation of the FTC rules. That is concerning as someone who agrees with Senator Cassidy that our focus has to be on restoring trust in the medical profession. And yet, over and over again, you seem to be at scale recommending products without telling your followers. And you have 200,000 newsletter subscribers. You have almost 1 million Instagram followers. And in only 3 out of 14 times on Daily Harvest, when you were promoting Daily Harvest, you disclosed that you're getting paid by them?
It sounds like you have a lot to say about this issue, and I would be very interested to see how your staff looked at this data. I have a strong feeling that the way in which they gathered this data is done intentionally to create these claims that you're making.
Well, I have the backup here. I mean, will you acknowledge that in many instances when you were promoting these products, you did not disclose that you had a financial relationship?
I don't think that's true. If it has happened, if it inadvertently has happened, I would rectify that immediately. However, I would be interested to see how your staff gathered this data.
I'll be happy to send it to you.
And I will conclude by saying that I take
all the committee members. I mean, it's pretty incontrovertible evidence.
I take conflicts of interest incredibly seriously. I've worked diligently with the Office of Government Ethics to make sure that conflicts are addressed thoroughly.
Welcome, Dr. Means. Addiction and drug overdoses are a major problem for families and communities in my state of Maine and across the nation. I am concerned that in your book on good energy, that you urge readers to consider psilocybin-assisted therapy. You also said that you were inspired to try psychedelics in what I can only describe as an internal voice that whispered, "It's time to prepare." Illicit drug use remains a huge problem in this country. And this didn't happen in your teen years. According to your book, in 2021, you began using illicit psychedelic mushrooms. So my questions to you are twofold. One, do you stand by what you said in your book, encouraging people to try psychedelics? And second, as Surgeon General, should you be confirmed, how would you speak to the American people about the use of illicit drugs?
Thank you so much, Senator Collins. And I also thank you sincerely for engaging so deeply with my work and learning about me. This is a very important question. And I would start by just saying that I believe what I would say as a private citizen is in many cases different than what I would say as a public health official. Joining a team where the purpose of this role is to communicate absolutely the best evidence-based science to the American people to keep them safe, thriving, and healthy. And when it comes to psychedelic therapy for mental health issues, I think the science is still emerging. And so it would certainly not be a recommendation to the American people to do that under no circumstances. I do believe that there is exciting work being done in this area that needs to continue on psychedelic therapies for PTSD and veterans, for mental health issues. And some of the researchers who are doing this work have said it's some of the most promising and exciting of their entire careers. So I look forward to following that, but to be very clear, under no circumstances would I recommend that to the American people in this role. Our illicit drug use problem in our country is monumental and severe, and I look forward to working with you on these issues that are so important.
What did you mean by saying that you heard an internal voice whispering to you saying it's time to prepare?
Yeah, in that passage of the book, I'm referring to my mother's passing, which happened. She got a diagnosis of pancreatic cancer about a week after that experience. And in my meditations and prayers at that time, I was having a deep sense that something ominous was coming. And so that's what that's referring to. I think when I speak of spirituality, and, you know, I do believe Americans are ready to hear about spirituality as it pertains to medicine. 80% of Americans are spiritual or religious. There's amazing evidence coming out of Columbia University, the lab of Dr. Lisa Miller, that spirituality has a large impact on health outcomes. And, so certainly that's a personal anecdote. But I again am committed to sharing only the best solid science with Americans on how to be healthy.
I understand totally what you're saying about spirituality, and I'm sorry about the loss of your mother. It's the link to illicit drugs that I'm having a hard time with. But I have very little time left, so I want to go to another issue, and that is in the staff interview when you were talking about wasteful spending, you referred specifically to money that NIH spent on Alzheimer's research that, quote, proved to be fraudulent. And you were referring to the amyloid plaque research replication issue that was discussed in the New York Times. That story, however, has been largely debunked and countered. So I just want to make sure that I know for certain whether you are for vigorous research on looking at a wide variety of factors when it comes to Alzheimer's disease and other dementias.
Unquestionably, full-throatedly, yes. This is one of the most devastating diseases facing Americans today. It's one that I'm very passionate about, particularly in light of research showing that early onset Alzheimer's dementia in as early as the 50s is starting to rise at a significant rate. I believe that we need to be studying, like you said, all the different medical, genetic, lifestyle, environmental factors that can be contributing to this. And when I look at the research that, some of the research that I'm very excited to elevate in the conversation, if I'm confirmed, I'd point to the Lancet study from 2024 about the modifiable risk factors for Alzheimer's dementia, which I'm sure you're familiar with, which showed that with 14 modifiable factors, we could reduce 45% of Alzheimer's dementia cases. This is incredible. This isn't really the type of research that we've been hearing from the medical community. We hear a lot about drugs. We hear a lot about interventions that slow decline once we're sick. But that's the type of research, like from the Lancet, major medical journal, that I really look forward to elevating, supporting further research like that can really help Americans be empowered to prevent this disease when we can.
Thank you.
Thank you, Chairman. Thank you for coming out, and congratulations on the new baby. I wanted to just ask you about the role of the Surgeon General, the different aspects of it. So one of it is about issuing public health advisories. Is that correct?
Yes.
I want to just ask, are you currently able to write prescriptions for patients?
I have not been seeing patients over the last several years, and so I currently, with the status of my license that I voluntarily put on an active status, which I'm sure what you're getting at, cannot prescribe a prescription right now. However, if I were to work with the Oregon Medical Board to reinstate that, it's very possible to do. And
is that something you're planning to do?
I'm not planning on prescribing prescriptions to Americans.
But are you planning to reactivate your license?
My path in medicine, I spent 4 years doing surgeries and seeing patients in clinics, and that one-to-one medicine, it's valuable, but my path took me down a different road to have a one-to-many approach to affect the root cause of why we're sick in America. And I've had a very successful.
So you're saying you're not going to pursue reactivating your medical license in taking this job. Is that correct?
I do not plan to reactivate because I'm not going to be seeing patients in this role.
So
it would not make sense to do that. In fact, for physicians, if I could just clarify, because this has been a point of severe misinformation from the media, for any doctor in a state where you are required to put your license on inactive if you're not seeing patients, I would imagine that many physicians in public health service who aren't seeing patients would have to put their license on inactive status because they are not seeing patients unless they choose to continue to do so while in office.
So another important role here, I just want to kind of clarify, because you're saying, you're you're not currently able to practice medicine, you're not currently able to write prescriptions because you're saying you're not going to be seeing patients in this job.
And I do have a medical
Another
license
big role of the work that you're doing is to be a leader of the Commission Corps.
Yes.
Is that correct? So I guess I wanted to just dive into this because, with the Commission Corps, it's saying as a Commission Corps officer of the U.S. Public Health Services, keeping professional licensure and certification up to date is mandatory. So I guess I just wanted to get a sense of how you're squaring this here.
Well, I do have a medical license right now. It is voluntarily placed on inactive status because I'm not actively seeing patients at this time. The HHS and Admiral Brian Christine have testified in front of this committee that I am eligible to serve as the medical director of the HHS.
But how does that square with saying here it says
nominee.
keeping a professional licensure and certification up to date is mandatory? Is yours up to date?
I have an I have a medical license that is unexpired right now. Admiral Christine has testified that I'm eligible to serve in this role. I'm the president's nominee for Surgeon General, and further questions about that will have to go to
So
them.
if you were to expand that, would you say that, like, with the others in the Commission Corps, do you think we should remove the mandatory licensure for them to be able to participate in the Corps?
That's not a question that I've considered. I don't think it's actually relevant to this particular hearing.
Well, it's relevant insofar as I'm just trying to think through, if you're in this job, how are you going to be proceeding, and what kind of advice you're going to be able to give to the American people and the credibility that they will have in understanding what your advice is. Also, in terms of, if you are a leader of the Commission Corps, I'm trying to get a sense, are you going to deprioritize having an active license in the same way that you believe that you can do the job of a Surgeon General without having an active license? Do you believe that that is the case for others in the Commission Corps, that they can do their job without having an active license?
Senator Kim, I'm a medical doctor. I graduated from Stanford University School of Medicine. I have a medical license. My professional history is a feature. It's not a bug. I have had a unique history that has merged entrepreneurship, public health advocacy, faculty, course direction at Stanford University, as well as being an editor of a medical journal and a biomedical researcher. And in these complex times for American healthcare, that type of multidisciplinary history is going to be extremely valuable for the American people.
I don't discount your accomplishments and your education, but what I'm trying to get a sense of here is your ability to be able to engage with our current medical professionals, to show respect to...
I practiced medicine. I owned my own medical practice, and I've seen thousands of patients, and I did over 4 years of surgical training, which is more than many of our past Surgeon Generals completed who did medical specialties. I have completed extremely thorough medical training, and I have the ability through these experiences to communicate excellent public health information, and I really look forward to working with the Commission Corps. This is an incredible group of people, 5,000 uniformed officers who are committing their lives to helping the American people. And personally, just to share a little bit of a vision,
I agree with that.
I just
want to say the signal that is being sent is one that I think we have to look at. And with that, I'll yield back.
Could I?
Yes, ma'am.
This incredible group of officers has traditionally been deployed for public health emergencies like natural disasters and infectious disease. And I think there's a huge opportunity to actually work with these members who are interested in approaching the chronic disease epidemic, which has not traditionally been part of their role. And I think that bringing that perspective and the demonstrated history of work in this area is actually going to be a really positive development for the Commission Corps. And I thank you for your questions.
Thank you.
Thank you, Mr. Chairman, and thank you so much, Dr. Means, for being here, for your family, and congratulations on the birth of your son. If you are confirmed, you know that you will be America's top doctor, and as such, people will be looking to you for scientifically accurate health guidance. So I wanted to drill down a little bit more to understand your views on vaccines and the science supporting Secretary Kennedy's vaccine vision. And I know you said earlier that this really isn't a part of your core message, but I know that you've talked about it before, whether it's on podcasts or on articles or tweets. And so, again, I just wanted to drill down a little bit more on that. And I know previously you stated that hepatitis B vaccine, giving it to a baby born to hepatitis B negative parents is absolute insanity, and I think you did an analogy to it being criminal. I was really pleased to hear you say so strongly here today that vaccines save lives, that you support the vaccinations for children. And so my first question is, if a mother is hepatitis B positive, is providing the vaccine at birth, the most effective way to prevent transmission to the baby. So again, if a mother is hepatitis B positive, is providing the vaccine at birth the most effective way to prevent transmission to the baby?
I believe certainly that is the most effective way. Again, I would just say, obviously the patient should talk to their doctor, but yes, that's a pretty clear case where certainly that would have a huge impact.
Thank you for your response. It appears, even as we're talking about the Secretary's vision for vaccines in this country, that he has basically searched the globe to find things to justify his harmful, unpopular vaccine policies. And just a few weeks ago, we had Dr. Bhattacharya here, the head of NIH, and we got into a dialogue, even with the chairman, about using Denmark as our peer to make these kind of decisions. On December 18th, 2025, the CDC announced funding for a study in Guinea-Bissau, a West African country with just over 2 million people. The CDC-funded study proposed withholding the hepatitis B vaccine birth dose from half of the newborn infants in the trial without screening all mothers for hepatitis B. And as you know, as a doctor, that when babies are exposed to the virus at birth, they can face very high risk of liver damage or cancer later in life. So as a doctor and as a mom, would you agree that it is unethical and dangerous to withhold a life-saving vaccine from babies at risk of a preventable disease?
These are obviously extremely important issues. I am not familiar with the announcement that you just talked about.
But hypothetically, just as a scientist, is it unethical to withhold life-saving vaccine for a baby?
I think that in the case where standard of care is to give a vaccine, and that's the gold standard, I have trouble imagining a scenario where a study would be able to withhold that treatment.
Right, because when...
But again, I'm not familiar with the study that you're talking about.
Yeah, and again, study is out there, but when a safe, effective vaccine is available, I think not just as a doctor, but as a human, we want to make sure that...
I don't believe that Dr. J. Bhattacharya or the HHS would be interested in withholding.
So we'll make sure you get the study, because what's interesting is that the researchers are also Danish, which is kind of interesting to me.
And also sometimes the devil's in the details, and I think I would want to look into this myself.
But as Surgeon General, it would be your responsibility to act legally and ethically. So you might oversee comprehensive scientific reports and oversee the commissioned corps who will conduct research and care for patients throughout the world. Would you advise against a study or refuse to conduct a study with serious ethical implications, even if the secretary or the administration pressured you to?
Certainly as a physician, as a person, as a mother, ethical concerns are of top priority to me, protecting patients, protecting children. am a strong-willed person who has no problem having direct conversations with anyone, and I would not hesitate to have direct private conversations with anyone about ethical concerns. And also, I do not believe that the secretary or anyone in the administration would ask me to do something unethical.
Well, we'll follow up with you on that particular study. I thank you so much for your indulgence, Mr. Chairman, and this is a vital kind of question for the foundation of this position. So thank you, and I yield back.
Thank you so much, Chair Cassidy, for hosting today's hearing. Dr. Means, welcome. Thank you so much for being at this hearing, and congratulations again on your beautiful, beautiful baby. I want to first begin by the places where we agree. The industry, you agree that industry should not have undue influence over our health policies. In fact, you have written that when pharmaceutical companies have a direct line to network television through advertising, and I quote, you say, they can have influence over what messages are emphasized on the news and what is deemed misinformation or truth. Now, can you confirm that those are your words?
That sounds like something I would say.
I'm sorry?
That sounds like something I would say.
Okay, perfect. And I also want to confirm again that you have been compensated. Have you ever been compensated for platforming, spotlighting, or highlighting companies in your newsletters or podcast appearances?
Yes.
Okay, so for example,
Podcast, but in my newsletter, I've had newsletter sponsors for my newsletter, yes.
okay, for example, Energy Bits. Have you received compensation from a company called Energy Bits?
Yes.
Okay, and in your newsletter, the very same one where you rail out against pharmaceutical advertising, you acknowledge that Energy Bits sponsored your newsletters. And I wonder, were you aware that the Better Business Bureau found that that company, Energy Bits, failed to provide substantiation for health-related and environmental claims and recommended that it discontinue doing so?
Senator Alsobrooks, I take conflicts very seriously. I've worked diligently with the Office of Government Ethics to make sure we've looked at all potential conflicts of interest, have signed a letter, had been cleared, and have signed a letter stating my commitment to divestments. And of course, during my time, if I am confirmed in office, I would take no money from any company.
Let me, Dr. Means, let me just add a little bit more here. I know the time is tolling. Were you aware that this same company was served notice under California's Proposition 65 law alleging that their products contain lead above the allowable levels? Were you aware of that?
Again, I just want to reiterate, in this office, I will not be taking any financial compensation from any companies. I will be complying with the Office of Government Ethics thoroughly before, during, and after my time in office, and I'm very committed to that.
Okay, let me ask you about another company. Have you ever received compensation from a company called Peak?
Yes.
Okay, and in your newsletter number 33, you acknowledge that Peak has sponsored you. Now, were you aware that this company was served notice under California's Proposition 65 for containing and failing to disclose that lead above the allowable amounts, a carcinogen and reproductive toxin, was present?
I just want to repeat, I've worked with the Office of Government Ethics. I am not going to be taking any
Okay,
financial
but we're talking about just the
compensation.
ones you've already, so this is an
We're talking
ethics.
about conflicts,
Mhm.
and I have been cleared by the Office of Government Ethics through an exhaustive process. I have signed a letter that I will be fully compliant, and this is before, during, and after the term. I take it very seriously, and I'll work closely with them to make sure there are no conflicts.
The point here is that you've received compensation from these companies, including Daily Harvest, where this company was subject to an investigation by the Food and Drug Administration after hundreds became seriously ill after consuming the product. And these are companies that you have received money from. They've been investigated, and you are railing out against pharmaceutical companies that you say are advertising these products that mislead the public, and yet you've received compensation from companies, and you've promoted them in your newsletter, and you're doing the same thing the pharmaceutical companies are doing by advertising and influencing people for these products that have been deemed to be unsafe for the public. Now, let me just move on as well to vaccinations. I want to just, you tweeted that you believe the hepatitis B vaccine at birth is a crime. That is what you tweeted. Do you recall tweeting that?
That is not the full tweet.
I actually do have the tweet. I can provide it for you. I have a copy of it here where you say that vaccinating, that you believe the hepatitis B vaccine is a crime. And I wonder, if you believe that, how is it that vaccinating children against hepatitis could be a crime?
I support vaccines. I believe vaccines save lives. I believe they're a key part of our public health strategy. I also believe that this administration is committing to making sure we have the safest vaccine schedule in the world, and that we are continually studying the vaccine schedule, vaccine injuries, making sure we're eradicating conflicts of interest in vaccine research and doing gold standard science on vaccines. These are all things that I support. And I think there's a nuanced conversation that American families are looking to have about shared clinical decision-making with their doctors about specific vaccines that their children may not be as seriously at risk for. And I think that that is the nature and the thrust of my comments.
Well, let me just follow. I know my time has expired. You have spoke on this panel about neurotoxin metals and vaccinations, yet you have promoted through a brief research. Okay, just this last sentence here. You through a brief search of the products that you've made money off of in your newsletters, many of them have been found to contain the same neurotoxins that you claim are in these vaccinations. I yield. Thank you.
Thank you, Mr. Chairman. Dr. Means, welcome to the committee here. I'm going to stick with vaccines here because I am on. I'm red. Is it better? Better? Yeah. Just too far away. Sorry about that. Sticking with vaccines, you have stated that there is, quote, growing evidence that the total burden of the current extreme and growing vaccine schedule is causing health declines in vulnerable children. And so I've heard your comments to several of my colleagues here today, so I want to drill down more specifically to the hepatitis B vaccine. My state of Alaska has had a very long history with this, including early childhood immunization campaigns that were targeted specifically to Alaska Native communities. We were seeing some just really startling issues with regards to liver disease in Native children. And so it was a pilot project decades ago that allowed for critical, timely vaccinations for these Native children in the outlying areas. It made a remarkable difference in Alaska, and I think other states, other countries look to that as an example. You have expressed the skepticism about the Hep B vaccine for newborns, and I need to try to understand your thinking on that, given the medical consensus that this vaccine prevents this serious liver disease and liver cancer, that we, again, were able to demonstrate in real time, real life, with that recommendation. And now the view that you seem to be taking on this is it is not necessary for newborn.
Thank you, Senator Murkowski, for being willing to want to clarify this with me, and also thank you for meeting with me. I really enjoyed our conversation in October with you and your staff. I think the concerns and comments that you're sharing, I think they're incompletely representing my views, and so I'll take the opportunity to share. This is an effective vaccine. I think it's a very important vaccine, and I think it's obviously Senator Cassidy knows better than anyone, given his work. This is a vaccine that has saved thousands, millions of lives. I don't know the exact number, but I do think that this administration is committed to making sure we have the safest vaccine schedule, and that parents have the opportunity to have shared clinical decision-making on specific vaccines with their doctor so they can make the best decisions for their family. This is not a condemnation of the vaccine generally, which I am very supportive of. However, I do believe that the thrust towards parents wanting to have the ability to have shared clinical decision-making with their doctor is important when there are conditions like hepatitis B where there's differential risk amongst different populations.
So you have said that the Hep B vaccine is, you stated this in response to a question on a TV show, is for a sexually transmitted disease and an IV drug user disease, which of course babies are not going to be exposed to. And one of the things that we have certainly seen with Hep B recognizing that it's this blood-borne pathogen, 100 times more infectious than HIV, not just contracted through sexual contact or drug use. In Western Alaska, where we see Hep B as endemic, we find that it's being spread through mosquito bites, where a child is itching an arm, ordinary household community contact, whether it's sharing food, toothbrushes, and minor injuries. And so this is where many in my state are looking at this and saying, we have been able to turn the corner on this. We're no longer seeing children with liver cancer, with this liver disease, and it is because the hepatitis B vaccine has been made available to them at birth. And so my hope is that as you are communicating the value of childhood vaccine, that demonstrated positive results of vaccines just like this would be communicated, and not just everybody needs to consult with their doctor. But if you're an Alaska Native population that has been systematically impacted in a way that we've now seen a marked difference, it seems to me that's where you should be directing it. I'm well out of time, sir.
Thank you.
Thank you.